politician in Northern Ireland. He wears that lightly, and Robin, it might not last. But while it lasts, I'd like to welcome you up to hear your thoughts as Minister of Health. You're very welcome, and it is very good to see you. The Minister, Robin Swann.
Thank you, Mark, for the introduction and in regards to being the most popular politician. I'm sure you'll do your best to correct that. Good morning, everyone, and first of all, can I start by thanking Michael for his kind introduction and his words of welcome here as well. Mark has mentioned the current political situation that we see ourselves and find ourselves in here in Northern Ireland. Michael talked about this conference being one of positivity and vision and drive and innovation, so I'll stick to the health service rather than talking about politics in Northern Ireland. But as Mark has said, I may have a few words later this evening. So, Michael, thank you for your introduction, and Heather, for you and your team for organising such a fantastic conference already. The buzz within the room, as Michael referred to, I think is testimony to the enthusiasm that is still within our health service. It's a pleasure for me to be involved with this event once again, and I'm sure, like me, you're delighted that we are able once again to hold it in person. And it's this year's conference, the theme of it, of recognition, ambition and mobilisation. And I believe that theme certainly sits alongside the agenda that I have set for my department in regards to rebuilding and improving our health and social care system over the next 5 years and beyond. But I want to take this opportunity to thank our workforce across our health and social care system for its your unwavering commitment to our whole society's well-being that is a testimony that we are where we currently are. Because the resilience that you demonstrate and have demonstrated in adapting to new ways of working at an unimaginable pace is to be commended. And I want to thank you. I want to thank you for your sacrifices that you have made to ensure that those that you serve, that we serve, are front and centre in all that you do. So, reflecting on your conference themes, I want to praise the work of our health and social care staff in not only rebuilding our capacity to deliver those critical services, but also in seeking to improve those services. And I think that's particularly true of our elective procedures and the recovery work, where we have long waiting lists that actually impact so much on people's daily lives. With your dedication and focus, we're beginning to see not only activities increasing, but also bringing on board those new initiatives. And I've always been consistent, and I've always pushed across my department on health and social care that we should celebrate our wins, no matter how large they are, because we need to always reinforce that positive message. One such improvement that I want to make today and announce today is that I am now able to announce that Daisy Hill Hospital in Newry will join the Mater Hospital in Belfast as our region's second elective overnight stay centre, and that will care for patients who require that overnight stay in hospital after surgery. That's another step in my commitment in the review of general surgery that we published earlier this year, because that review spells out the challenges of the current configuration of our services across Northern Ireland. But I believe it also acts as that positive building block for the wider transformation of our entire health and social care system. Our elective care centres will provide a dedicated resource for those less complex planned surgeries. They will be part of a wider healthcare reform initiative, actually involving those dedicated hubs for planned surgeries and procedures. And their aim is to enhance the quality and the consistency of care, improve our productivity, and help bring down our waiting lists. In this post, in this tenure, I've always been clear that transformation and indeed reconfiguration is required to drive sustainability and also to improve our capacity, and that we will continue to need every square inch of capacity in each of our hospitals. So today's announcement on Daisy Hill actually underlines that commitment. And as an elective overnight stay centre, that provides elective care, not just for the local population, but also for the region. Daisy Hill Hospital will now be a critical part of Northern Ireland's elective network. Surgeons and patients alike will travel to Daisy Hill Hospital from across Northern Ireland. But as well, and looking forward to the rebuild of our integrated care system. And as we look forward to that, our focus has to be on how we better plan, how we better deliver our services to meet the challenges facing our system and our population both day and daily. We have all seen, everyone in this room has seen the devastating impact of health inequalities on our population and the services that we provide. But we've also seen that agility, we've seen that innovation, and most importantly, we've seen that collaboration. But the challenges have not been helped by the way our system is currently shaped. We simply cannot continue to operate in the same way because it simply won't work. But the transformation journey cannot only be about how or where we deliver services, but how we plan them. So learning from you and your experiences has actually brought us, I believe, to where we want to be. And that is a system that works as one system. A system that is actually underpinned by collaboration and integration. A system that makes the best use of available resources. And a system that delivers what we want to improve the health and well-being of our population. That's the journey on which we've embarked, building an integrated care system for Northern Ireland. So we must harness those many strengths, those strengths that lie within our health and social care sector. And that includes our partners in the voluntary and community sector, it involves our partners in local government, and it involves our partners who are service users and carers. And it's that model that will actually ensure that the right people are working in partnership much more effectively, maximising that potential across the entirety of our system. It will provide that real opportunity to develop how we assess our population's needs, ensuring what we do is needed and delivered in the best way possible. And we've already seen progress in that area. Last week I announced the launch of our regional mental health service, which will be an integral element of the new integrated care system. That new service embodies, I believe, the partnership approach, which will actually ensure people across Northern Ireland will have that equitable access to high quality, regionally consistent but locally based mental health services. So continuing our journey of transformation, I'd actually like to share with you an example of quality improvement. The recently developed Health and Social Care Quality Improvement Strategy 2022-24 is called Moving Forward, Shaping the Journey. Its vision is to inspire and influence Northern Ireland's health and social care community to become a global leader in quality improvement and innovation by working together and focusing on that person-centred care. And an example of that work is already underway. It's linked to the priority of improving timely access to safe care, actually harvesting the learning from teams who are delivering that best practice across our system with an aim to deliver prototypes for system-wide scale and spread. And today I'm proud to share that 8 outstanding teams will be presented with this year's Quality Improvement Awards. And I want to commend and thank each team for the work that they and the other finalists undertake, actually focusing on improving care, driven by compassion for people. And as how we look ahead to a brighter, more improved future, I'm also delighted to announce the publication of my department's advanced care planning for now and for the future. That policy is for adults in Northern Ireland, and the policy is about people. It's about people having the opportunity to have those conversations with those important to them and those providing care. That conversation to make their wishes known, to make their feelings, their beliefs and their values, and to make their choices that reflect those. This is the first step on a road that I hope will lead to more people having the opportunity to reflect and talk about what matters to them, what they would prioritise in the future should they become unable to make decisions for themselves, but to make those timely, realistic and practical plans for their future. You'll hear more about that work at a breakfast fringe session tomorrow morning, where I would encourage everyone to engage, as it's something that does involve all of us. So whilst we must look for long-term actions, those long-term actions to address the significant pressures that are facing the delivery of health and social care services, we also need to look for those short and medium-term measures that will help us build sustainable and high-quality services for the future. Evidence has shown us that where healthcare systems have leveraged digital well, there has been a rapid enabler of efficiencies and improvements. And again, my department has been working to develop a new strategic direction, a direction that will ensure that we make the most of this opportunity to improve services and to create better outcomes for the people of Northern Ireland and their staff. And it's our health and social care digital strategy that will make the delivery of healthcare services more efficient and help to reduce delays and waiting lists. It will make the jobs of our health and social care staff easier by creating those joined-up systems which will store information in the same place and thus enabling effective care decisions to be made both quickly and easily. So for patients, for clients and carers, this will mean the delivery of more consistent and reliable services, enabling them to have greater control over their own health and care, as well as better ways to communicate with those who provide those services for them. So achieving this is a process. It's a journey, and it involves a change in culture in our sector, because the people of Northern Ireland actually deserve a modern and convenient experience from health and social care, and they are at least as good as those in other industries and in other sectors. So the Encompass programme and the wider digital investment portfolio will be our way of bringing that into practice. That includes the developments which may help detect earlier signs of common and serious conditions such as heart disease, respiratory disease, diabetes and cancer. Earlier detection and management, along with much improved monitoring outside of hospitals and clinics, could potentially transform the provision of health and social care, because it's our digital strategy that will chart a course to enable such developments to be identified and implemented within our system. And I will be encouraging my officials to ensure that this work is taken forward again as a priority. But to implement successful and meaningful change, we need a strong and reliable workforce. So the growth and development of our workforce has been a key priority for me and my department. And providing that focus to the aspirations of our workforce, it was in May 2018 that we published the Health and Social Care Workforce Strategy 2026, delivering for our people, with an aim that by 2026 we meet our workforce needs and the needs of our workforce. On the 15th of June this year, I launched the strategy's second action plan, That provided that updated and refreshed direction of travel for the next 3 years. But we know that the challenge of ensuring that transformed health and social care service must have the right numbers of appropriately trained staff with the right skills mix, and that the department and employers provide conditions that make us an employer and a trainer of choice and be multifaceted. It requires additional sustained investment because that's needed to grow our local workforce, to develop those opportunities that provide alternative pathways into a career in health and social care, but also to ensure that the growth of our workforce is supported through other avenues of recruitment, and that includes those available internationally. But I'm also mindful that we need to ensure the needs of our existing workforce are fully met. And the workforce strategy contains a range of actions actually aimed at improving staff health, improving staff well-being, and improving staff safety at work. And it has that specific focus on addressing the issues of retention, because we must deliver that agenda alongside a meaningful and sustained reduction in the level of expenditure on agency and locum staff over the next 3 years. I want to set out clearly and say clearly to those agencies who provide temporary staffing to the health and social care that one of my key priorities is to eliminate the use of off-framework agency usage and actually harness a new collaborative way of working with on-contract agencies. Because our off-contract expenditure is not sustainable. It's not a cost-effective use of taxpayers' money and can lead to a lack of workforce continuity, which has the potential to destabilise the safe care of our patients and destabilise our existing teams. So next week, our procurement and the logistics service of our business services organisation will actually launch a new public procurement, and that will seek agencies to provide nursing and midwifery agency staff to our health and social care system. That procurement will close in November, and the new framework will be put in place in the new year. And my expectation is that those agencies which secure a place will start providing services to health and social care by February next year. A second procurement will follow for the supply of medical and dental locum staff, and there will be further work to cease the use of social workers employed by recruitment agencies and trusts. However, those financial pressures and budgetary uncertainty facing my department we know are unacceptable, and they continue to seriously impede our ability to deliver the ambitions we have for our workforce. And on the issue of finance, as has already been touched on, I'm on record as warning that the funding pressures in health may be significant by the second half of this financial year, and that any financial budget settlement is unlikely to be sufficient to meet our needs. But as Minister, I will continue to do the best that I can to deliver for the public with the resources that I have available and the time that I have left. So to live within any likely budget settlement would require me to take forward unacceptable actions which would directly impact services to citizens. And again, I've been clear and remain clear that I will not be implementing those decisions. Given the ongoing absence of an executive or indeed an agreed budget, there is a clear risk that we will soon reach the point where overspend cannot be prevented. And if we are continue to take the required actions to deliver safe and effective health and social care services, we know that the ongoing political situation is also impacting on how we plan for future years. Consequently, there will not be funding for all that we want or need to do. So therefore, we will need to focus on making the best use of the resources we already have through greater levels of productivity. And in closing, I'm determined to do all I can to rebuild a healthcare system that is efficient and fit for purpose. And I'm confident that we can rely on each one of you to embark on this challenging journey with us on behalf of the people of Northern Ireland, because I firmly believe that together we will achieve more. Thank you.